Hi everyone, my name is Bruce Bassi. I'm a psychiatrist with Telepsych Health. Today I'm going to be talking about starting your own practice in private practice in either psychiatry or in some other specialty. So I wanted to make this video because there really wasn't that much information out there for me to go off of when I was starting my own practice. And so, yeah, there were some books, but they were a little bit outdated, and I felt like I couldn't really relate to what some people were talking about. So this video is intended for people who are just out of residency and considering starting their own practice versus going to work for a hospital or a clinic, or for somebody who's in the middle of their career and looking to make a switch. And so while this video, from my perspective, is more intended for people who are in psychiatry or in mental health, I think it's because it is probably a more viable option to have your own practice in psychiatry as there's less overhead. Um, it's certainly also an option for somebody who's in family medicine or internal medicine, especially if you're considering starting your own virtual practice. And I know that this process isn't for everyone. There's a lot of legwork that's involved. You have to really have a knack and an interest in the business aspect of things. But I think it is rewarding that you have a lot more flexibility. There's that sense of value and purpose where you're working directly with patients, and that this is something that you created. And so for me, I feel a little bit more motivated to go to work each day knowing that this is something that's a practice that I own and I'm not working for somebody else. So after residency, I was really excited to go and work on my own. I was fairly tired of working for some other individual and having to listen to what the way they wanted everything done. And so when you're starting your own practice, I think that's one of the great advantages is that you can think about what your patients experience in the entire process, and you can customize that process. You have complete control over everything that they experience, from your intake person to the consent forms and to the intake process. And then that experience with you in the office or online, and you have complete hiring ability over anybody who you want to work with you. And so I think that's some of the main advantages and disadvantages. Main advantage of having your own practice, but I will talk about the disadvantages and drawbacks to having your own practice when it comes to billing and tax purposes. So like I mentioned, I started the practice right out of residency. I didn't have any experience in entrepreneurial skills or entrepreneurship, and I didn't have any sort of understanding or prior experience in business. So I don't have my MBA. I basically was coming at this process just looking online, looking on Google, maybe talking to some people who have gone through the process themselves. But really, there wasn't too much to go off of. So the very first thing that you have to think about is what kind of corporate structure that you want. Do you want either an LLC? Do you want an S corporation? Do you want a C corporation? And there's various tax benefits and drawbacks to each of these structures. And there's tons and tons of videos and resources that you can get and look at on your own time. So I didn't really want to go into the details of those structures, but you have to think of a structure and which one works best for you. And part of that process involves first thinking of a name. And that's something I ended up actually changing the name of the business because my lawyer had advised that one of the legal requirements is to have your name in the name of the business. And so certain states have various laws saying that your legal name of the business needs to say that it's a professional corporation. You have to have some part of your name in that name. And so your lawyer in your state can advise you on what the legal name needs to be. And you can choose what the legal name is. And then you can also specify what you're doing business as names. So if you have ever seen in various types of legal agreements or on people's websites or in certain invoices you might get from various companies, it might say DBA or D/B/A, and that stands for doing business as. And so that's the name that company is interfacing in the public realm. And so while they might have a legal structure, a legal name that is registered with the Secretary of State in their state, They might have a doing business as name, which is their public name that they go by, maybe on their website or on other sort of marketing materials. And so once you get your corporate structure settled and confirmed in your mind what you want, you have to then register that with the Secretary of State in your state. And that involves either hiring a third-party agency like LegalZoom, which is probably the largest ones, but they're largest one, but there are other ones, or having a lawyer do it. And so it might be a little bit more expensive having a lawyer do it, but at least you know that you're doing it the correct way, the most appropriate way, and you're not going to have to go back and potentially revise anything. And that could be pretty costly. And so sometimes paying a lawyer up front to advise you about your situation, making those recommendations appropriate to your state and your situation, will save you time and money further on down the road. So it might be a little bit more expense finding a healthcare lawyer who has a license and practices in your state, but it could save you time and money down the road. And so your lawyer could potentially create the corporate structure with your Secretary of State in your state. And so once you register with that state, the state is going to send you some sort of certificate, and that certificate is going to have your your business registration number, some sort of registration number that is used to identify your business in your state. And so from there, that's pretty much the first requirement for starting the process of having your own business, having your own private practice. From there, you would register with the federal government to get an EIN number. So it's also called the tax identification number or employer identification number. And so this is going to be the number that is assigned to your business for, and a lot of, it's going to have a lot of purposes. So when you want to register for a business bank account, you're going to need to have an EIN number. And so this EIN number is going to be used for tax purposes, used for insurance companies. When you interface and interact with the insurance company, they're going to ask you for your EIN number, and also for any sort of banking purposes that you might have. And one of the other advantages to having a lawyer register your business for you in your state is that when you do register that business entity with your state, you're going to need to have a registered agent. So this is something that you'll need to think about if you have a physical brick and mortar office versus a virtual practice, or maybe you operate in multiple states without any sort of brick or mortar office. And so a registered agent is essentially some way that the Secretary of State or some other official can interact or interface or correspond with your business. So if you want to have a professional registered agent, you'll need to hire a company to do so, and it's very inexpensive to do that. It's probably about, I don't know, $15 to $30 a year or something like that. And so there are a number of businesses out there in your state that can be hired as your registered agent. And so you just appoint them as your registered agent to handle any sort of legal correspondence in your state. Finding office space would probably be your next step, because you'll be using that address as your business practice. And so you will need to think about if you're going to be having a brick and mortar office versus an online practice. Because you'll need that address to register with the insurance companies, and it's very difficult to go back and change that address. When you apply to an insurance company, that address and that name takes a long time to get propagated throughout their system and go online. And so to get it onto their directory, it might take multiple weeks to get updated. So you want to just figure out what your practice name and what your practice address is going to be before you even start interacting with insurance companies. So you want to have that all set out right from the start. Or if you're an online practice, finding some sort of virtual mailbox. And so there's multiple companies that allow you to register for a virtual mailbox, because most insurance practices don't allow you to have a PO box. You'll need to have some sort of post office service that has some physical human being there to accept mail and delivery. And so if you're going to be looking for an office space in psychiatry, you want to think about the location and also what the patients are going to be experiencing when they go to your office. And so you want to consider patient privacy. When that patient waits in the waiting room, what's their experience going to be like? And is that going to be a private experience for them? And how are they going to be leaving? Is there going to be somebody who's waiting at the front desk? And so you want to consider location as well, because If you're going to be operating in an area where there's numerous other competitors, it might make it more difficult to grow your business. And also, location is important because you want to consider how are the patients going to be getting to you, and it's going to be convenient for them. Are they going to be taking public transportation? Are they going to be driving and parking? And is that building going to have parking, or they need to park on the street? And so when you're thinking about a physical office space, those are some other considerations that you have to take in mind. So there's multiple ways that you can do this. If you're thinking about opening a brick and mortar office, in-person office, you can either look at one of the office space companies like Regus or WeWork or Liquid Space, or you can join some sort of shared space that's out there. And there's, other practices that you could potentially reach out to and see if they're willing to, if they have extra office space, maybe see if they're willing to lease out some of that office space. Versus the other option is having a virtual practice and having an online practice, which comes with its own business, tax, and legal issues. If you're going to be operating in multiple states, it can be pretty complicated. I would suggest first starting off with a virtual practice in one state. And so the office is, when you're operating a virtual practice, the office is actually considered to be where your patient is living. And so if you are seeing patients in California, for instance, those patients need to be physically present during the online visit in the state of California. So they can't leave the state of California, because then it would be as if you are running your practice from that outside state. And so that is essentially illegal, and considering to be practicing medicine without a license in that state, because obviously you know that you need to have a license in the state that you're practicing in. So when a patient travels even temporarily, you should technically contact the medical board of that state that they're traveling to, and then determine if it's okay to practice in that state to see that patient once. And so that is kind of the technicality where the laws haven't quite caught up to the issues revolving around virtual practices, because obviously patients are going to be traveling and moving. And so one of the main advantages of a virtual practice is that there's continuity of care there, because about 10% of people move each year. 10% of Americans move each year. And so that creates a patient turnover where each time they move, they need to look for a new physician. And when you have a virtual practice, you're able to continue to see those patients despite them moving, as long as they stay in that same state, or if they move to a state where you also have a license in. And so it can be pretty costly managing and renewing licenses in multiple states. To apply for a license in a state, it's usually between $500 and $800. And then you also need to think about the tax considerations of having income in that state, and what are those laws revolving around that state. And so each time you do move to another state, you might have to just check in with your lawyer just to get approval. And so the legal fees, I mentioned when you're first starting off, it could be a few $1,000s to pay a lawyer to just review everything and check over that you're doing everything appropriately for that state. And same applies to when you start seeing patients in another state too. And so now that you have an address, you have a tax identification number, you're registered with your state, your Secretary of State for your business entity, now it's time to start applying to insurance companies to become in-network or paneled with those insurance companies. And so this can be a very long process, and it does consist of two separate parts. And some insurance companies merge those two parts more seamlessly than others. And so there's the contracting portion, and then there's the credentialing portion. The contracting portion is basically where the insurance company presents you with a contract that's usually about 10 to 20 pages long about how you guys are going to handle claims and all these other sorts of legal agreements. And that is one part of the process, and also going to include your fee schedule too on there. So it says, what the CPT code is, and how much you're going to be reimbursed for that CPT code. And so that's called a fee schedule, and that would also be included in contracting. And so sometimes you might do the contracting portion first, and then move to credentialing, or they might be jointly merged, and you're going to be doing both in a parallel process. And I have experienced an insurance company where that was the case. And then there's another insurance company where we did the contracting first, and then they sent me to the credentialing portion second. And so the credentialing portion, I don't know the exact internal process that they have, but they're basically verifying your credentials, because I think you probably have heard of stories where individuals have practiced medicine and they actually weren't even doctors, they weren't therapists. And so the insurance company is required to make sure that you are who you say you are and you have that education that you're saying that you have, because obviously they have a duty to their patients to make sure that you are a legitimate provider and that you're going to be offering the services or giving the services that you say you can offer and upholding the standard of medicine that you should be practicing. And so that's the reason for the credentialing process. And that credentialing process can take between probably 5 weeks on the shorter end of things to up to 12 weeks. And I have one outlying insurance company in California, and actually there was another one that actually took about 6 months. So it can take a long time, but there are a few insurance companies that actually do work much more quickly. And so you could get the ball rolling in just a matter of months if you did want to go down this route and have your own practice and be in network with various insurance companies. I do think it's important to get that ball rolling with the insurance companies because that can take multiple months. And so you want to get that started up front. And so while you're working on other things like choosing your EHR and developing your website, those insurance companies can be in the process of doing the credentialing portion. And so while they're doing that, you'll need to have some time to figure out which EHR you're going to use, like which electronic health record you're going to use. And so there's probably hundreds out there. When I was looking through EHRs to use, I kept a database of about 35 that I ended up getting tutorials and demonstrations of. And so it can be a pretty arduous process because you have to contact that company, wait for them to contact you back. Then they put you basically on all of their spam mailers, and then you have to schedule a demonstration with one of their reps, and then find a mutually agreeable time. And then they'll show you the EHR, and you might have to basically view demonstrations of multiple EHRs to kind of get a sense of what you're looking for and what's important to you. And for me, what I wanted was having all-in-one features, something that had basically a patient portal where patients can interface with me. It had charting in it. It had a billing manner, a billing structure where you can send claims to the insurance companies, and then you get what's called a electronic remittance advice, and that's the electronic evaluation of that claim that comes back. It's called an ERA. And so when the insurance company sends that back to your EHR system, you're going to want to see what came back and what was approved, what was paid out, and how much it was paid. And so that's called the ERA. And so that will have to be incorporated in your EHR. And so I also wanted to have a prescribing ability and also a way to order test results and have some scheduling features. And so there's a lot of different features that I wanted incorporated. So I didn't want to have to go to multiple different sources to get all this done. So I chose one that has a pretty low cost structure, but also provided a lot of value to me. And that one was called Charm, CHARM. And they're based out of California, but they offer all-in-one service, and they're improving. They have some hiccups. I think all of the EHRs that you'll experience have some drawbacks. And so for me, I had to keep a database of all the features of various EHRs, and I can talk about my way that I evaluated the EHRs in a separate video. So also, while the insurance companies are credentialing you, and that process is ongoing because it's going to take multiple months, you want to start a website kind of towards the beginning of this process, because that website is going to be the way that patients are going to find you. And so when people Google search, it's going to take some time for that search engine algorithm to propagate your website up into the search results. And so that can take multiple months. And so search engine optimization is a pretty big industry for a lot of people. So you'll want to think about having appropriate keywords on your website so that helps with your search engine optimization, and also having valuable content on your website, because that will drive your website up higher in the search results. And when you do start a website, you'll want to have it so that there's transparency there. And also, since we do live in America, you'll have to have all of the legal disclaimers on the website. And so the legal disclaimers will say basically, we have not established a doctor-patient relationship, that this is not intended for medical advice and things of that nature. And so you'll also want to have your lawyer provide you with that sort of disclaimer that you can put in the footer of your website. In developing a website, you'll have to find a hosting service, and so there's multiple out there. I ended up going with Squarespace. I'm not the most happy with them because there's not really as much customizability. It's really designed for somebody who just wants to get content up there and not worry about the back end of things. But I think the drawback to that versus going with somebody like WordPress, for instance, is that there really isn't as much customizability as in WordPress. So WordPress has a lot more apps and things that you can add to your website to give you a lot more features. And so Squarespace doesn't really have that ability, and is a bit more expensive than WordPress as well. So when you get the website going, you want to keep generating new content, and that will drive the search engine results up so that people can start finding your website more easily. And you also want to think about reputation management of handling reviews and what your online presence looks like, because obviously patients don't really have too much to go off of. They're going to be essentially just looking at your profile on an insurance company website, if you are in network with an insurance company, and then probably Google searching you and checking out your website briefly. And so they might also, when they Google search you, look at other sorts of health grades or review websites. So you want to consider where are people leaving their reviews, and how are you going to handle those sorts of reviews, if it's through like Google Businesses or through Yelp or through one of the other websites like Vitals or Health Grades or something like that. And so there's actually services out there that do website or reputation management. And so you might have to pay them a fee, essentially like between $20 and $50 a month for them they can essentially collaborate all of those reviews. And what I use is called Embed Social. And Embed Social basically collaborates and brings together all of those reviews from either Facebook or Google, and it allows you to put that in a section on your website so that people can see the reviews in from multiple services. So after you've gotten the ball rolling with insurance companies and you're starting the credentialing and contracting process with them, the next thing you'll want to think about is billing. And billing is probably one of the most difficult pieces of having your own practice, and I think is the worst part about the job, and probably the biggest drawback to having your own practice versus joining a clinic or joining a hospital. Because this is not representative of the majority of patients. I think most of the patients are very appreciative of your services and willing to pay you, but there is a percentage of patients where they'll just go missing in action. They'll go completely MIA, and you won't hear from them again. And they won't respond to your letters, they won't respond to your phone calls, they won't respond to your emails, they won't respond to your text messages. And so you're not on salary anymore. So if you don't collect your money, you're not going to get paid. And honestly, you need to put food on your table too. And so figuring out ways to prevent that from happening, and determining the most appropriate policies for your clinic is very difficult, because what one patient might think of as a totally legitimate, normal policy of having a credit card up front, another patient might take complete offense to that and find that that's really not appropriate. And so patients have so many varying perspectives and viewpoints, and so there's not any one policy that everybody is going to be happy with, and that's just the bottom line. And so you have to think about what is the best way that you're going to optimize your collections process and optimize your revenue, essentially. And so this is sadly one of the parts that most doctors and most providers don't really want to think about, because like me, anybody who's gone into this field probably has gone into it for really good reasons of trying to help people and wanting to do good, and making sure that those people who need those services get the services that they deserve. And I think that there shouldn't be any sort of discrimination against patients who aren't able to pay. And I think that I do agree that patients who need treatment should be able to get treatment. But the problem is when patients go to a private practice and they purposefully, knowingly know that they have some sort of patient responsibility that they need to pay, and then decide later on that they don't want to pay it. So I don't mind if patients were to go to a nonprofit or go to a hospital system and upfront say that this is my income and this is what I can afford to pay. Can we figure out some sort of payment plan for this? But some patients don't end up doing that. And so you'll realize later on that sadly, a lot of people are living paycheck to paycheck and can't afford visits, but will come to see you anyway without intentions of paying. And so you might see them a few times or one time or two times, and then they just won't respond to you again. And so they might essentially use you and see you as kind of transactional, where you're either just filling a prescription or providing some sort of medical advice to them, and then they just expect it to kind of move on. So one reason why I started my own practice is because I really enjoyed getting to know my patients, but not everybody kind of has that that perspective of getting to know their physician. So when you do have your own practice, since you're not on salary, you're not going to be getting a steady paycheck despite whether or not the patients pay. And so that's one of the advantages of working for a hospital system, is that regardless of no-shows, regardless of patients not paying, with the hospital being on salary, you know that you're going to be getting a steady paycheck. And so when you have your own practice, however, your income, it may vary throughout the year. There's busier times of year than other times of year. And you're also going to be getting paid about 3 to 4 weeks after each visit. So you also need to figure out how to handle denied payments. So ideally, every sort of claim that you send to the insurance company will be paid at 100% and 100% of the time. However, sometimes those claims are denied, especially if you're using something like a telepsychiatry or virtual visit modality, where you might not get a straight answer from the insurance companies up front whether or not they are covered, the patients are covered for that service. And then you'll find out after the claim is submitted that the service was not covered, and that's not any fault of your own, but the insurance company is just not giving you that information up front. And so you'll have to figure out a way to handle denied payments or underpayments. And so maybe under less than 5% of the time, the claims, when they come back through the ERA, you'll have to just check and make sure that they're paid out appropriately to your fee schedule. And so sometimes, and it might be pretty buried in various claims, you'll have to just determine how much that claim was paid out and what was the appropriate amount. And so that can be kind of complicated, and it can be pretty time intensive going through each claim and understanding, what was the appropriate amount, and then also what are some outstanding claims that still need to be paid out. To hire a billing service, you might be paying about 5% of collections. So like 5% of what you're collecting, you might have to go towards billing a biller, for example, or you might have to hire a biller who has experience in this. And this is a career path for some people, going into medical billing, or you can do it yourself when you first start off. And that's what I did when I first started off, was just doing my own billing so that I had a better understanding of what that process was like. And once I knew what that process was, I can teach it to somebody else. And so that's the route I went, rather than hiring a biller, because I didn't really understand what the value of hiring a biller was. And I wanted to get a better understanding of what that was, so it wasn't like a mysterious thing to me handling medical billing, and I wanted to understand that better. So after you've contracted and credentialed with insurance companies, you have an EHR, you maybe have a billing person, you also want to develop some sort of consent forms that describe the policies of the practice. And I think this is one of the nice things about having your own practice, is that you set your policies and you're not going by what a hospital dictates. But on the flip side of that, that means that you have to put the time in and think about what your policies are and what's going to be appropriate for the vast majority of patients. And so that can be pretty time intensive, developing a consent form, figuring out how you're going to be handling and delivering those consent forms to the patients, and then scanning them back in. What I use is a service called JotForm. And so it's an online website where you can basically make an online form. They sign it electronically, kind of like an e-signature. And then that PDF gets sent to me securely, and I upload it to the patient's chart. So that's my process of handling that. But you also need to have some sort of support staff that helps assist with that paperwork, and also who answers phone calls for you, because while you're seeing patients, You're not going to be able to answer the phone calls and see patients at the same time. Although I do know a couple of people who are in private practice who end up just responding to voicemails directly on their own afterwards. After they finish seeing patients, they'll respond to voicemails. Technically, it's not illegal to not have an answering service, but it is probably more ill-advised. I mean, one of the suggestions is to, again, have another disclaimer, but this time in the form of a voicemail greeting saying that if you're having any sort of emergency or suicidal thoughts, that you need to contact 911 or go to the emergency room. And that needs to be in your voicemail greeting if you're not going to have an answering service 24/7. So if you're having your own practice or you're starting your own practice and it's just going to be you as the single provider, that's a liability for you. And if somebody calls you expecting to reach you, you're going to have to figure out a way to handle those sorts of emergencies, or describe to them what the most appropriate way to handle that is if they're on their own. Some private practices hire a answering service. So the answering service will essentially take the message, determine if it's an emergency or not, and then either call your personal cell phone number so that you don't have to give that personal number out. So after the answering service gets that message and routes that message to you, you'll just call that patient back afterwards. So figuring out your phone line that you're going to have, because if you're on your own and you're a single provider having your own practice, you need to have some sort of extra phone line. I didn't want to have to get another cell phone line because it was quite expensive to just get another cell phone. So what I did, and there's a lot of companies out there that offer a voice over IP phone line. So you can essentially have an app on your iPhone that is assigned to an actual phone number, and your cell phone, the app will ring the phone like as if it was normally ringing, and you need to have pretty solid internet service in order for it to work well, because there are a little bit of quality issues with the VoIP lines, and so you have to have fast internet. So that was one of the drawbacks of that, but the services are usually about $10 to $20 per month for that extra line, and you usually do get voicemail and text messaging ability as well, to have that all be separate from your business line. One of the nice things about having your own practice is that all of these expenses are tax deductible, and so when you do have your own phone line, you can pay for that through your business credit card. So once you get an EIN or a TIN number from the federal government, from the IRS, what you'll then do is open a business bank account, and from there you can open a business credit card line, and you can use that credit card to pay for all your business expenses, so that it's a lot easier to deduct them from your taxes. So I know that there was a lot here in this video to talk about what the benefits and the drawbacks to having your own practice are versus going into a clinic or working for a hospital system. So you want to think about, does this fit into your career goals? If you're maybe early on in your career path and you want to really focus on family time, maybe starting this private practice isn't the best idea for you, because it is going to require a lot more time upfront, at least in terms of researching the business aspect of things, and figuring out the legal structure and the tax implications and what all the laws are in the states you're going to be practicing in. And so that can be pretty time intensive, and there isn't any sort of upfront reimbursement for that, at least monetarily. And as I mentioned, when you're starting your own practice, since you are going to be starting off small and growing the practice, and that's a long process, there's a lot more responsibilities not having any sort of business partner with you upfront. And so when you go on vacation, or you're away from the office for whatever reason, you'll still need to be on call and be checking messages pretty consistently, and checking either messages through email, although email is not secure, I mean through the patient portal. So you'll be responsible for getting back to those patients in a timely manner. And I think if you do so, that shows that you're a provider who really cares and values good quality patient care, and that you value their time and you respect them as individuals in order to respond to them in a pretty timely manner, because you care about them. So I hope you enjoyed this video about setting up your own private practice, whether or not it's in psychiatry or in family medicine or in therapy. And if you have any sort of questions, please comment below. And if you like this video, I would really appreciate it if you press the like button or subscribe to my channel. Thank you so much. My name is Bruce Bassey. I'm a psychiatrist with telepsychealth.com. I do online visits with patients, doing general adult psychiatry and addiction psychiatry. Thank you so much for your time, and we'll talk again soon.